But we're gonna. All right. Good afternoon, everyone. Good afternoon. My name is Craig, and today we're welcome to Freedom Friday. This is one of the groups that we talk about dual diagnosis. We're going to talk a little bit today about dual diagnosis. And if you don't know what dual diagnosis is, this article that I'm going to present today going to shed some light on what is dual diagnosis. All right. And so today is May 31st, Mental Health Awareness Green Day. As you can see, it may not look like green on the camera, but yes, I have on green because May is Mental Health Awareness Month. So we want to dispel any stigma, stereotypes, misconception about mental health, because we know that people can get better with the proper medication and through the proper help through professional. I have someone here that you cannot see currently, and her name is Angelique. And so she's going to be sitting in with us. And so without further ado, let's get right into it. So as you can see, the title says dual diagnosis, right? Dual diagnosis, substance abuse and mental health, all right? And so dealing with co-occurring disorders, learn how to tackle addiction when you're also dealing with depression, anxiety, and another mental health problem, right? And so one of our discussion for today is the link between substance abuse and mental health. That's key. This is very key. The link between substance abuse and mental health, right? The article goes on to tell us that when you have both a substance abuse problem and a mental health issue, such as depression, bipolar disorder, or anxiety, it is called a co-occurring disorder or dual diagnosis, all right? So when you have a mental health issue, right, along with substance abuse issue, this is known as co-occurring or dual diagnosis, right? Dealing with substance abuse, alcoholism, or drug addiction is never easy. And it's even more difficult when you're also struggling with mental health problems. A lot of times people is not aware that they are or that they have a mental health issue while they under the influence of alcohol or drug addiction. And so once people get diagnosis, not oftentimes people are being diagnosed as having both substance abuse and mental health. This article says co-occurring disorders, both the mental health issue and the drug or alcohol addiction, have their own unique system that may get in the way of your ability to function at work or school, maintain a stable home life, handles life difficulties, and relate to others. To make the situation more complicated, the co-occurring disorders also affect each other. When a mental health problem goes untreated, the substance abuse problem usually gets worse. And when alcohol or drug abuse increases, mental health problem usually increases too. All right? And so this is very important to know about the two, because we come to learn that when a person has been diagnosed with mental health and substance abuse, and when they go into treatment, a lot of times the professional people, the counselors, or the medical people, they will treat both, because you can't treat one and ignore the other. Okay? So it goes on to say, co-occurring substance abuse problems and mental health issues are more common than many people realize, according to reports published by published in the Journal of American Medical Association, roughly 50% of individuals with severe mental disorders are affected by substance abuse. That is a high number, 50%. 37% of alcohol abusers and 53% of drug abusers also have at least one serious mental illness, right? All people diagnosed as mentally ill, 29% abuse alcohol or drugs. While substance abuse problems and mental health issues don't get better when they're ignored, in fact, they are likely to get much worse. It's important to know that you don't have to feel this way. There are things you can do to conquer your demons, repair your relationship, and get on the road to recovery. Remember, I said people do get healthy with the proper treatment and the proper help. With the right support, self-help, and treatment, you can overcome a co-occurring disorder, reclaim your self-sense, and get your life back on track. That's good news for a lot of people who may feel that they are dealing with dual diagnosis, substance abuse, and mental health. And they may say, well, I'll never get better. That's not true. That is not true. Let's talk about another topic that we have here, topic rather. What comes first? I'm glad you asked. Substance abuse or the mental health problem? This article lets us know that substance abuse and mental health disorders such as depression and anxiety are closely linked. Although one doesn't necessarily directly affect the other, abusing substances such as marijuana or methamphetamine can cause prolonged psychotic reactions, while alcohol can make depression and anxiety symptoms worse also. So a lot of times they have a term, Angela, they call it masking. When a person may not know how to deal with their emotions, and they may be having anxiety, or they may be in a state of depression. A lot of times they may use alcohol or drugs to give them the sense of feeling better, when all actuality it's really not making them feel better, because now you're dealing with issues that you're not finding the right coping mechanism to help you alleviate or combat those feelings that you're having. Because now some people may need medication because it may be overwhelming. Because yesterday we talked about trauma. All right, we got somebody that's online, and hey, Dawn, that's three groups already. Nice. Glad you was able to join us today. And so yesterday, the other group we was talking about, I believe yesterday was talking about traumatic experiences from trauma. So a lot of times when people have a hard time letting go of a traumatic event, they call that a chronic disease. They oftentimes need medication and a therapist or a psychologist, all that good stuff. All right. I just want to share some information with you. All right. And so let's move further along. And so we're still talking about what comes first, substance abuse or the mental health problem. Alcohol and drugs are often used to self-medicate. Look at this right there. Self-medicate, or another term, masking the symptoms of mental health problems. People often abuse alcohol or drugs to ease the symptoms of an undiagnosed mental disorder, to cope with difficult emotions, or to temporarily change their mood. Unfortunately, self-medicating with drugs or alcohol causes side effects, and in the long run, often worsen the symptoms they initially help to relieve. Alcohol and drug can cause the underlying risk for mental disorders, since mental health problems are caused by a complex interplay of genetics, all right, the environment, and other factors. So there are a multiplicit facet of mental health, or why mental health occurs. This article says the interplay of genetics, the environment, and other factors. It is difficult to say if abusing substances ever directly causes them. However, if you are at risk for a mental health issue, abusing alcohol or drugs may push you over the edge. For an example, there is some evidence that those who abuse opioid painkillers are at greater risk for depression, and heavy cannabis use has been linked to an increased risk for schizophrenia. I never knew that, but now I know. Wow. Alcohol and drug abuse can make symptoms of a mental health problem worse. Substance abuse may sharply increase symptoms of mental health or even trigger new symptoms. Abuse of alcohol or drugs can also interact with the medications such as antidepressants, anxiety medication, and mood stabilizer, making them less effective at managing symptoms and delaying your recovery. Oftentimes, you ever read on a medication bottle, it says, if you're taking this medicine, please do not drink alcohol or other medication that may hinder or affect this medicine. Yeah, and so this article reminds me of that a lot when it talks about if you're using alcohol or drugs, it can mess with antidepressant medication, anxiety medication, and mood stabilizers. All right, and so it says make them less effective at managing symptoms and delaying your recovery. Wow, this is some good stuff. Remember, if you wasn't aware, next year, May of 2025, this is the last day of May of 2024. May is known throughout, I believe, the nation of, or the United States of America, as Mental Health Awareness Month. I don't know about any other place, but I know in the state of New Jersey is known as Mental Health Awareness Month. All right, we're celebrating. I have on my green, and so let's go on to another topic. Angela, you okay? All right, good. The second topic we want to touch on, and that is recognizing a dual diagnosis. All right, recognizing a dual diagnosis. Let me see if I can. Dawn, are you still with us? Let me know in the comment if you're still with us. If so, I want to bring you on. Let me see if I can bring you on. Okay. Let me see if I can share the screen with you. All right. You have your camera on? Select the tab to share. I want to share you on into screen. Let me see what that looks like. All right. What that is there. All right. I can't see you, Dawn.
She's on it.
Are you able to turn your camera on? Let me pull a full layout. No. All right. Well, I'm going to keep on moving forward.
You can take that back.
All right. All right. We're going to move forward. Stop sharing. All right, so we're talking about recognizing a dual diagnosis. All right, and so this article says it can be difficult to identify a dual diagnosis, right? It takes time to tease out what might be a mental health disorder and what might be a drug or alcohol problem. All right, so let me see what she said. Oh, you're driving. Okay, all right, good. All right, then. Please do not turn the camera on. All right, good. All right, so let me read this again. Recognizing a dual diagnosis. It can be difficult to identify a dual diagnosis. It takes time to tease out what might be a mental health disorder and what might be a drug or alcohol problem. The signs and symptoms also vary depending upon both the mental health problem and the type of substance being abused, whether it's alcohol, recreational drugs, or prescription medications. For an example, the signs of depression and marijuana abuse could look very different from the signs of schizophrenia and alcohol abuse. However, there are some general warning signs that you might have a co-occurring disorder. This article said there are signs and warnings that a person may have for co-occurring disorders. First bullet says, do you use alcohol or drugs to cope with unpleasant memories or feelings, to control pain or the intensity of your moods, to face situations that frighten you, or to stay focused on tasks? The second bullet says, have you noticed a relationship between your substance use and your mental health? For an example, do you get depressed when you drink, or drink when you're feeling anxious, or plagued by unpleasant memories? Remember, we're talking about warning signs of co-occurring disease. All right? Third bullet says, has someone in your family grappled with either a mental disorder or alcohol or drug abuse? Do you feel depressed, anxious, or otherwise out of balance even when you're sober? Have you previously been treated for either your addiction or your mental health problem? That is a key question. I'm going to read that again. It says, have you previously been treated for either your addiction or your mental health problem? Did the substance abuse treatment fail because of complications from your mental health issues, or vice versa? These are key questions that we need to ask ourselves and to be on the lookout for warning signs. All right. Dual diagnosis and denial. All right. Dual diagnosis. We want to talk about dual diagnosis and denial. Denial is common in both substance abuse and mental health issues. A lot of times we are, especially if we're not ready to seek help, we may say, well, there's nothing wrong with me, I'm fine. But as we read earlier, a lot of times when we have issues with substance abuse and mental health, it can cause problems at work, on a job, at home, concentrating, doing tasks. And so those things need to be looked upon and to give a self-analysis and say, well, am I able to function adequately without the substance abuse, whether it be alcohol or drugs? And if so, if I don't drink or I don't use drugs, am I focused on the task at hand and there's no distraction, or there is, I have the ability to pick myself up if I'm having a bad mood. And if I'm having anxiety, do I have coping skills to say, well, how can I combat this anxiety Do I need medication, or do I need to see a therapist? Do I need to see a psychologist? Or am I able to just take some time, pause, stop, and analyze the situation and get back on course? So these are some things to think about. I'm not saying these things that I'm suggesting. Things I am suggesting is seeing a counselor, therapist, a psychologist, and the medication aspect if that is being prescribed by a doctor. All right. So the other techniques, you will have to get that through a counselor. All right. I'm only a recovery coach, sharing some information, encouraging people to be aware of what's going on with your body, with your mind, and with your health overall. All right. And so it says, it's often hard to admit how dependent you are on alcohol or drugs or how much they affect your life. Similarly, the symptoms of conditions such as depression, anxiety, bipolar disorder, or PTSD can be frightening, right? Can be frightening. So you may try to ignore them and hope they go away. Or you may be ashamed or afraid of being viewed as weak if you admit you have a problem. That doesn't make a person weak. That makes a person strong. At my point, my view, because it's letting you know you are able to identify that there is a problem, and that if you let someone know, I applaud you for being courageous enough to say, "Hey, listen, I'm having issues and I need help." Because if they oftentimes they said, I don't know if you ever heard this, Angelique, a closed mouth doesn't get fed. All right, and so we want us to speak out, speak to our situation, let people know what's going on with us immediately. You don't want to wait till it becomes too overblown, whereas it's going to take more to treat the issue than it is if we catch it at an earlier stage. All right. But substance abuse and mental health issues can happen to any of us. Let me read that again. But substance abuse and mental health issues can happen to any of us. And in many, you have a problem, and seeking help is the first step on the road to recovery. Wow, this is a good article, because, that's the first step to recovery. If you ever been to any AA or AA meetings, they say the first step especially the 12 step, it tells us the first step is admitting that I have a problem. I don't know all the steps. I don't have them with me. I have a book here. Maybe I'll find. Let me look into it. Let me see if I see if all the 12 steps in here. You know what? I think we need to do something on 12 steps, and maybe we can get ourselves more in tune of each steps. How you feeling?
All right.
How you been though?
Good.
Good? Yeah, you like you ready for the summer?
Yeah.
All right, good. You're smiling, you look happy, and so that you have a great attitude. And so I'm glad that you came and you sat here. You told me you was coming, and you kept your word.
Mm-hmm.
And so you could have been any place that you want to be,
Mm-hmm.
but you came here because you're working on some things,
Mm-hmm.
and that's what information is all about. Sharing information is so healthy. Just to have a good, wholesome conversation that talks about the healing process, the intervention process, the holistic aspect of becoming a greater person than we were yesterday, last week, last month, last year. and making strides to become a greater person each and every day. So, because a lot of times we may be surprised how much we can help other people who maybe just starting out on their journey, but they may have a little stumbling blocks along the way. And so it's our job to help them, pick them up, and let them know that, hey, if I can make it, you can make it as well. You know, this is a non-judgmental zone. And so I'm going to read one more, if that's all right with you. One more, all right? And we're going to get right, and then we'll be done for the day. And that is, I'm going to put it right here on this board. Bear with me. Signs and, all right. Yep. All right. I'm going to put that right on the board. Bang. Signs and symptoms of substance abuse. Abuse substances include prescription medications such as opioid painkillers, ADHD. Do you know what medication? Do you know what ADHD stands for, Angelique? Huh?
No.
Attention deficit hyper disorder. All right?
Mm-hmm.
That's people dealing with, they are very hyper,
Mm-hmm.
you know, it's hard to concentrate. So they have medication for that, right?
Mm-hmm.
Attention deficit hyper disorders. And sedatives. And so sedatives are medication. So let me read what the article says. I don't want to give my definition. It says recreational or street drugs such as marijuana, methamphetamines, and cocaine, and alcohol, beer, wine, and liquor. A substance abuse problem is not defined by what drug you use or the type of alcohol you drink, though rather it comes down to the effects your drug or alcohol use has on your life and relationships. In short, if your drinking or drug use is your life and relationships, in short, if your drinking or drug use is causing problems in your life, you have a substance abuse problem. To help you spot the signs of a substance abuse problem, answering the following question may help. The more yes answers you provide, the more likely your drinking or alcohol use has become a problem. All right, the first one. Have you ever felt you should cut down on your drinking or drug use? Yes or no? Boom. That's up to you to decide. All right? These are only questions. All right? And it says, do you need to use more and more drugs or alcohol to attain the same effects on your mood or outlook? Right? So that let me know your tolerance. As you know, tolerance level, you may start out drinking 3 beers in the course of a day, and it was fine. Now you may drink 6-pack and a pint of liquor, all right? Because now you understand? So now your tolerance has increased. Do you lie about how much or how often you drink or use drugs? Are you going through prescription medication at a faster than expected rate? Have your friends or family members expressed concern about your alcohol or drug use? All right? Do you ever feel bad, guilty, or ashamed about your drinking or drug use? Another one it asks, have you done or said things while drunk or high that you later regretted? Has your alcohol or drug use caused problems at work, school, or in your relationships? And the last one, has your alcohol or drug use gotten you into trouble with the law? We're talking about signs and symptoms of substance abuse. And so that's it for the month of May, dealing with mental health awareness month. Please join us next Friday at 1 p.m. This is our Freedom Friday Recovery Support Group. This is a non-judgmental zone. We're glad for all those who are watching. Dawn, stay safe. Enjoy your weekend. Lord willing, I'll see you in class on Tuesday. Angelique, thank you for coming. All right. And so that's it for this week. Take care. Enjoy yourself. Love on someone. And remember, stay safe. If you can help someone overcome alcohol addiction, or if you can help someone, assist someone to professional help that they may need for both alcohol and mental health, please don't judge them. Don't look down upon them. Lift them up with some encouraging words. Let them know that they're not alone. And until the next time, I am Craig. So long.